Doctors of Reddit, what was the most incorrect self-diagnosis you've encountered in your practice? I've had a patient claim that amputations run in his family. He said that was the only reason he needed both legs taken off above the knee. He was adamant that it was not actually due to his uncontrolled diabetes, his enormous and continual sugar intake, his refusal to use insulin, or his refusal of treatment for the giant infected wounds on both feet. Edit. If you are here to make a remark about how no one runs in his family, please be aware that we are currently experiencing unusually high call volume. So please remain on the line and your comment will be read by the next available representative. This happened in med school. I was taking the history of a guy in clinic and I asked about his past medical problems, including if he had had any heart attacks. He responded, "Oh yeah, I've had about 20 of those." You've had 20 heart attacks? Which doctor did you see about them? Do you have a cardiologist? Nah, I never went to a doctor. My wife is a massage therapist, and whenever a heart attack hits, she starts to massage some pressure points and it stops. Okay, what does it feel like when you have a heart attack? I don't ever remember them. My wife tells me that I fall onto the floor and my arms and legs start jerking. She says it takes about a minute of her massaging before it stops. I then get really confused and tired afterwards. And I can't remember much of anything that happens to me until I take a nice long nap. The dude was having seizures and thought that they were heart attacks. They normally stop on their own after a few minutes, at the most. And his wife thought that her massages were curing him. Lady came to the clinic with her 8-month-old baby and she was pretty freaked out. Her baby had diarrhea for the last few weeks and wasn't going away. She initially wasn't concerned, but then her friend told her that diarrhea is the first sign of AIDS and now she was convinced her baby contracted AIDS. We quickly ruled that out through their med records and assured her that her baby didn't contract AIDS randomly. As we finished examining the baby, it started to cry, so we handed it to her mother. Lo and behold, she pulls out a baby bottle to get the baby to stop crying. Only this baby bottle is red and is filled with Kool-Aid. We had to explain to her that babies can't handle sugar at that age and that was the cause of the diarrhea. She refused to believe what we said. I was raised on Kool-Aid and look at me, I'm fine. Man, the south side of Chicago is a completely different world. Edit. Another story from that clinic. A lady came in and after she got off the scale she asked what her weight was at. She 10 pounds heavier than the previous visit and seemed upset. So I asked her what about her weight was bothering her. She said she was trying to lose weight but it didn't seem like her diet was working. I casually asked what her diet was, thinking she was trying some of the new diets. Her answer was bacon. Her friend told her that if she added bacon to all her meals she'd lose weight, so she had been eating bacon 4-5x day for the last month. She was shocked when she learned that she was doing the exact opposite of what she was supposed to do. Edit 2. The reason these two cases come to mind is because I was shocked by the lack of common knowledge. These people aren't dumb, they just didn't know what they were doing was wrong. It's a symptom of poverty and a lack of education. Both patients took the proper steps to correcting their misunderstandings and were admittedly embarrassed. As far as the race questions go, I now work in a rural, majority white, part of the Midwestern US with similar levels of poverty education as the south side of Chicago, and these patients have the same issues. They just don't know. Full stop. Veterinarian here. Hope you won't find this out of place. I had a client come in several years ago with a dog suffering from flea allergy dermatitis. These dogs have an allergy to flea saliva that causes them to get insanely itchy, primarily around the rear end and base of the tail. This poor little guy had chewed his fur out to the point that his back half was just about completely naked. So there he sits scratching and biting at himself, covered in fleas, several of which I have combed off of him and showed his owner. Good news, I say, we can fix this. After explaining the diagnosis, his owner proceeded to tell me how foolish I was. The dog was not itchy because of fleas. He was chewing at himself as a psychological response to the disturbance caused by having his butt shaved by an unknown intruder who must have broken into the house while they were away. I had no response to that other than to agree that, yes, that must have been very traumatic for him. Ultimately we agreed to treat for the fleas, just in case. Shockingly, the dog got better. Edit. Thanks for the gold, stranger. For everyone asking about itchy dogs cats, here's my spiel. There are 4 things that cause itching in 95%, if not more, of cases. 1. Flea allergy dermatitis. 2. Atopy or environmental allergies to pollen, dust, etc. 3. Food allergies. 4. Sarcoptic mange or scabies. 1 and 4 can be cured. 2 or 3, which are far more common, cannot, but they can be treated. Individual animals can have several of those problems at the same time. To further muddy up the waters, pets who scratch at themselves because of one of the above issues are often afflicted with secondary yeast or bacterial infections. This is their body's natural flora taking advantage of a bad situation, not something contagious that they picked up from another animal. So, the vet's job is to first, get rid of any secondary infection, and second, try to diagnose and treat the underlying cause of the itchiness. This second part can be a frustrating, time-consuming, and expensive process for the owner. In the case of allergies, food or environmental, we're talking about blood work, multiple types of skin tests, and a hypoallergenic diet trial that lasts 6-8 weeks. Hopefully that will give a little bit of insight into why it's tough for most of us to fix skin problems in one visit. As always, your pet's vet should be able to help you through this process. Just make sure you have realistic expectations. The dog I talked about above is one of the few cases where the answer and fix are super obvious, at least to me. So I'm a therapist and I work with kids. Worst misdiagnosis was a family with a 2-week-old who was convinced the baby had 1. Anxiety because he cries. 2. Autism, little eye contact. 3. Bipolar disorder because baby would seem content then angry. I spent hours explaining child development, what these diagnoses mean, how they would present in kids. I provided them with books, handouts, etc. They insisted on going to see my co-worker and a psychiatrist, as I was surely lying to them. Even after meeting with the other 2 professionals, they still weren't convinced. They requested psych meds from the doc. A patient came in with what he thought was a rash and the flu. He ended up having necrotizing fasciitis and was dead by the next day. And edit, necrotizing fasciitis is pretty much flesh-eating bacteria. Had a 19-year-old girl come in asking for antifungal medication because she was convinced she had oral thrush. Her and her boyfriend had googled her symptoms, and at 19 you're never wrong. When I suggested that perhaps we check an EBV antibody to rule out mono, she looked at me like I was actively drooling on myself and refused, because there was no way I can have mono. Eventually I convinced her to have some diagnostic testing done, and sure enough she had mono. I tried to explain that having oral thrush as a 19-year-old could possibly be much more concerning than mononucleosis, but she didn't seem to get it. I will give the caveat that if a patient volunteers that they were looking up their symptoms online, I'll always ask them what they think they have and why. This can sometimes give insight to symptoms or concerns they may not have let on about that help me to make a correct diagnosis. Besides, taking an active role in your health is certainly not a bad thing, as long as you're not being a douche and acting as if I'm some moron. I welcome that kind of discussion. I was the person self-diagnosing. I thought I had a really bad muscle spasm. I actually had cancer. Oopsie. I had a male PT come into the ED complaining of breast lump. He anxiously stated that the mass was very painful to touch and was convinced that he was going to die of breast cancer. After a battery of questions I asked him to take off his shirt so I can examine and palpate, read, touch the mass. After a couple of seconds, I turned to him and said, "Sir, that lump is your rib." He called me a dumb kid and asked to see my attending. I was a student at the time. The PT asked the attending why, if it is a rib, that it would hurt so much. The doc replied, "Sir, you've been rubbing and irritating the area for days now. You've been hurting yourself. I've never seen a man leave the hospital that fast." Edit. ED equals emergency depth. PT equals patient. Patient is diagnosed with invasive ductal carcinoma of the breast, confirmed with biopsy. Surgery prepped for 2 weeks time. Patient goes to an outside facility and does a mammogram. Radiologist read states it is benign. Patient writes an email to her primary doctor, "My attending. Prayer works. Please find attached report stating I no longer have breast cancer. Please tell the RX surgeon that I will be no longer needing surgery. Q furious emails to surgeon with sense of impending doom. TLDR, mammograms don't pick up everything. Edit to add, sorry there is no resolution at this time. This happened last week. The patient's surgeon is now in charge of counseling her to change her mind. Double edit 2 weeks later. Patient has been convinced to get the surgery. As a self-diagnosing patient, one day notice a white, hard, jagged object protruding from my back gum. Can't believe I'm having a tooth come in. Especially since I'm 23 and had my wisdom teeth taken out years ago. Go to the dentist to get some x-rays and it turns out to be a piece of a tortilla chip. Just finished med school, so not too much experience. But had an elderly woman come in the ER with new onset seizure. The patient's daughter was convinced her mother had a brain tumor. On review of the medications, turns out the patient had been out of her Xanax prescription for 4 days and had a withdrawal seizure. Man came into the ER in a panic thinking he had incurable skin cancer. Turns out he had a wart on his foot. This is only tangentially related to the topic at hand but gave me great joy at the time. So I thought I'd share. During my time as an intern, a patient was admitted for anemia, hematocrit of 16, requiring blood transfusions. Turns out that at some point in the past, after she was diagnosed with an inborn error of metabolism, her primary care physician prescribed her vitamin B12 injections. Your body requires B12 to make hemoglobin. Instead of going back for refills after she ran out, however, she headed over to her local pharmacy, bought vitamin B6 tablets, and proceeded to take 2 per day, and went on to explain how, you know doc, it's the same thing. Yeah. No. Anal cysts. Nope. He just touched his anal cavity too much and left it irritated. While working as a nurse, had a patient who insisted that her abdominal pain was from a surgery she'd had done on her arm. She thought that a staple that had been used to close the wound on her arm had somehow traveled to her abdomen. One time I had a patient tell me he gets nervous on airplanes just to get some Xanax. Self-diagnosis? I'm an orthopedic surgeon, so patients are really often unable to diagnose themselves because they don't have the power of MRI or scoping. The most incorrect self-diagnosis I've encountered was a patient who believed they broke their hip after a fall when they actually had a 2-inch piece of skateboard lodged into their side they forgot about. Yeah. Optometrist here. This happened while I was on rotations as a student. The practice was used to seeing patients from rural areas, educated up to high school, usually some missing teeth. Anyway, this lady was convinced she had a bee in her eye, but it sounded more like there's a bee in mirror. I had to leave the room to get the doctor so he could translate. She had floaters. Edit. Lots of questions about what floaters are. When the jelly in the back of your eye degenerates down to a liquid, you see shadows of the chunks of jelly floating around in the back of your eye. Very common as you get older. Even common in some younger people who've played rigorous sports. Football, gymnastics, etc. Thanks for all the upvotes everyone. I'm a long time lurker and this is only my second post equals. My boyfriend was born in a teaching hospital. Because of the size of his head, a bunch of doctors informed his parents that they believed it to be a brain tumor just days after he was born. It ended up being that he just has a huge head. 2. Can I play? Only a vet, not an RD. Real doctor, but a young couple brought me their young ginger cat, requesting euthanasia because he had cancer. I asked why they thought so. They cited the tumors on the margins of his eyelids, which were actually normal pigmentation, or ginger cat freckles, and B, that there were drops of blood when he jumped into the empty bathtub, which were actually rehydrated flea dirt falling off the cat onto the wet tub. I talked them out of euthanizing their perfectly healthy cat. Not my story, my dad's. An ER doctor. He once had a patient duct tape a huge bag of weed to his chest and ride his bike full speed into a parked cop car. The guy thought he was in the hospital because of some big government conspiracy that he knew too much about, but it ended up just being a broken arm, and probably schizophrenia. He then ended up suing my dad, so he was really an all-around great patient. Another story from my dad. During his residency he had a patient in her 70s who was diagnosed with terminal cancer and given a couple of months to live. 10 years later the same woman came into the emergency room because she broke something when she fell off her bike. Not a doctor, but my PCP told me that I had a sinus infection when I actually needed a heart transplant. Got my transplant 3 years later. Doing great now. My boyfriend's friend's dad went into urgent care with severe chest pain. Doctor takes one look at him and writes it off as bronchitis, without any tests. Later that night, he died in his sleep from a heart attack. His wife sued the hell out of that doctor. Edit. I know it's not a direct answer to Arp's question, but it's similar and I wanted to share. For those of you asking, his wife did win the lawsuit. I don't know how much money she received, but I do know the doctor's license was revoked. Also, I don't know much more about what he talked to the doctor about. He could have expressed concern about heart problems or he could have expressed concern about respiratory problems. I heard the story from my boyfriend who heard it from his friend and this happened at least 3 years ago. A lovely healthy 50-something lady patient presented with her best friend because she was unable to walk. It turns out she had been becoming weaker over the past couple of months and now had been bedbound for 2 weeks. As she talked she waved her hand over her right breast and mentioned something about a problem there. I took a look. She had breast cancer that was so advanced that it was ulcerating through the skin in an area about the size of a small orange. I'll never forget seeing that. It's such a shame because she was such a lovely lady. We talked for about half an hour and during that I found that she had put it down to a lot of stress overwhelming her life lately to do with her son leaving home and a few other things. She seemed like a spiritual lady, and she was so sensitive and overwhelmed at the time that I had to take things very slow with her. During that 30 minutes I really felt that I connected with her and slowly helped her understand what was actually going on and that the next few weeks would be tough with treatments etc. This was about a month after I had started as a junior doctor. The next day I got a complaint to my supervisor by the head nurse for taking too long with a patient, plus a whole lot of other made up stuff about being unprofessional etc to make her claim sound better. Had to go to meetings with management etc. Anyway, the reason the patient couldn't walk was because of high calcium from metastases all through her bones. I treated that and she was able to walk again a few days later. I looked up a file about 3 months after and she was still alive, on hormone therapy to slow the cancer's progression. Had a friend come to me claiming she was surely dying and had colon cancer. She had dark stool, among some other things. The bloody stool being the smoking gun. I asked her what she had been taking to help with her stomach pains. She said Pepto-Bismol of course. I told her to stop taking the Pepto-Bismol and told her to go see her primary physician about it. Sure enough it was just the Pepto-Bismol. Not a doctor but people self-diagnose themselves with mild autism on Tumblr all the time. I'm not a doctor, but a medical translator. I was translating for a refugee patient who asked me to tell the doctor that every bone in her face and hands was broken. She was very insistent that this was the case. She also asked the doctor for a full body beautification surgery and this was at a free clinic. It was apparent that her face and hands were not broken and when I relayed the information to the doctor he looked very confused. I'm pretty sure the patient was just a bit crazy because they sent her out of there with nothing more than some margarine. Patient had diarrhea. It was yellow and liquid. The patient said there was something very wrong, and somehow the tubes got crossed inside of their body because the pee was coming out of their butt. Patient calls 911 because they are in cardiac arrest, not a family member reporting that their heart had stopped. No, the patient made the call and said they were in cardiac arrest. Patient comes in with a gangrenous toe. He says it will get better with antibiotics. He doesn't need to come into the hospital. He knows his body, etc. He left AMA with the antibiotics he came in for and told to return if anything changes. The patient came in the next day. The toe fell off. Patient gets diagnosed with cancer. Doesn't follow up with the surgeon. And many calls were made by the surgeon to get the patient to meet in the office. 6 months passes, and the patient shows up in the ED for something unrelated. Ask about the cancer and how treatment is going. The patient says they never followed up because I had a lot to do that weekend. The spouse was right there and didn't appear to know about the diagnosis. Some are funny and some are just heartbreaking and sad, and unfortunately, the patients are not the only ones that make incorrect diagnoses, but occasionally the doctors do too. A girl I know works in ER, and not too long ago a college-age kid came in around midnight to get tested for herpes. They figured it must have been pretty bad for him to go into the ER. After further investigation, a small red dot turned out to be an ingrown hair. We self-diagnosed an animal completely wrong on this one. A few days ago our cat started breathing really funny and wheezing. Google and past experience told us respiratory infection. So on Saturday we take him to the vet, and it turned out 3/4 of his lungs were filled with cancer. We had to put him down. We also once had a teacher make my mom send my brother to the doctor because he obviously has that staph infection thing that's going around. We took him. He had mild acne. I'm not a doctor, so I was at a friend's house spending the night. I had fallen asleep and forgot to take my contacts out. I wake up and my eyes were really hurting. I go to the bathroom to take out my contacts. I claw at my left eye and eventually manage to remove the lens. I do the same thing to my right eye, clawing at it trying to remove the lens. Eventually I realize there isn't even a contact lens in my eye, so I freak out thinking it had somehow slid up behind my eye. I claw at my eye even more, digging around for my contact lens. I still didn't find it. A few hours later my eye is driving me crazy and hurts like hell. So I get my parents to take me to a walk-in clinic. They basically tell me I'm an idiot and that contact lenses can't go behind your eye. And apparently in my sleep I must have scratched it out of my eye. Also I scratched my eye up so bad it got infected and I went blind in that eye for about a week. Everything is fine now. But now I know not to sleep with contact lenses in. TLDR. Fell asleep with contact lens in. Scratched eye really bad. Went blind for a week. Had a guy come in for migraines and confidently proclaimed that the severe head trauma he had suffered 1 month prior had nothing to do with it. I'm not a doctor, but I work in the med field. I had someone come in and tell me she was overdosing on Tylenol. One must consume 10,000 milligrams of acetaminophen in a 24-hour period before they technically start overdosing. I found it to be highly unlikely because you'd most likely throw up from the effects of it on your stomach before consuming that much. It turned out she was having a bad trip on meth. Someone thought they had a strained muscle in their leg because it locked up and they couldn't bend their knee. Then an abscess formed at the top of their leg right at the pelvic bone, and blood pus started literally pouring out, non-stop, for days. Eventually he came to the doctor's office, then straight to the ER, and had an abscess in his psoas muscle caused by a perforation in his small intestine. Yep. Pretty far off on that guess there, but apparently it happened right after some heavy lifting. To be clear for all you gym rats, no, it was not in any way associated with him lifting. It was a result of undiagnosed Crohn's disease destroying his intestines. Had one guy come and thought he had a bad pimple or a boil. Turns out it was a gummy bear. Not a doctor but a physio. Had an elderly female patient ask if she should go and have her prostate checked because her father died of prostate cancer at her age. Bless. Obligatory not a doctor, but when I was 9, I could not move my foreskin back to wash. Doctors blamed it on being uncircumcised, and they said I would have to be circumcised immediately if I didn't want excruciating pain in my teenage years. After much thought, I decided to go for it. Turns out I had the rare WebD. I won't go into too much detail. Anyway, they didn't figure it out until they were in the middle of a routine circumcision. So the operation took 3 times as long and cost twice as much as predicted. I also had D scabs for a month. On the bright side, I got to watch TV and eat ice cream for 2 weeks during the recovery process. Real story: as a third-year med student, was rotating through a Southside Chicago hospital. Aka the Hood. Female patient in her 50s. Sexually active with one partner. Thought she was pregnant and asked for a pregnancy test. Since she was not menstruating for last couple months. Pregnancy test comes back negative. Meantime we work up the history of her experiencing all the classic symptoms of menopause. Anyways, When we tried to explain to her that it was menopause, a natural physiological response to aging in females, she got extremely upset, requested for a repeat pregnancy test, which we obliged to. Once again, results came back negative. Tried explaining to the patient once more what menopause was. However, she told us we were making crap up, to put it pleasantly. When asked what she thought was wrong, her explanation, in her words, were as follows. 1. I am pregnant with baby Jesus. 2. I need to get a new boyfriend. This current one can't even get me wet in bed. We tried one last time to explain the situation. However, she stormed out and never came back. True story. Self-diagnosed pulmonary hypertension. Had several transthoracic echocardiograms, like 10 in the last 2 years, and 3 right heart catheterizations indicating that they had normal pressures. Demanded that I document pulmonary hypertension and requested that I fill out some employment benefit forms stating as such. Started talking over me as I tried to explain the diagnostic criteria for pulmonary hypertension and how they did not meet any of them. Refused to look at the echocardiogram reports and RHC data I had printed off from his medical record to justify my refusal to label him with the diagnosis. I thought I had pancreatic cancer. Turns out it was just an infected gallbladder. They removed it and I am 100% fine now. Just a few weeks ago, I had a patient come in for an eye exam. She tells me that her allergies are really bothering her eyes and she just needs her eyeglass prescription tweaked. Her best corrected vision is 20/80 and her retina is a mess. She's got Stargardt's disease, not previously diagnosed. She is going blind and there is nothing we can do to stop it. I want to refer her to a retinal specialist to confirm the diagnosis, but she refuses because it's just allergies and I just need to prescribe her some drops. I should also add that her eye were not at all tearing, itching, and there was no inflammation of the conjunctiva at all. Not that this would cause your vision to drop to 20/80 even if they were present. I had some clear, slightly yellowish fluid run like water from a faucet out of my nose for a few seconds once. Cleaned myself up, then went to Wikipedia, expecting it to be completely normal. Then I found that it had all the makings of a CSF, cerebrospinal fluid, leak, which could be caused by a brain tumor apparently, possibly due to head trauma. I play sports pretty often, so head trauma sounded like it was a definite possibility. It said if it happened again, that I should get it checked immediately, since it could be indicative of a potentially life-threatening condition. That sounded bad, so I waited a few days, and it didn't happen again. In the meantime I did some more research, and apparently it's also common to have a fluid drain like that when you're just getting over a cold, which I was. TL. Doctor thought I had a brain tumor. I didn't. Edit. Thanks for all the fun replies guys girls, but I think it's time for me to go to sleep. TL. DR. My highest karma comment of all time is about my own stupidity. Figures.